We're at the scene of accident, and now we can see that the patient is lying on the ground unconscious. So first we have to check whether the area is safe for any treatment and first aid to be given. Secondly, we have to wear personal protection equipment like gloves, and after that we have to approach the patient.
Right.
And the person giving first aid will be asking somebody else to call the ambulance. In Russia, the emergency number is 112. Now the patient checks whether the patient is conscious or not. In this case, the patient has no consciousness. Okay, so we have to start giving first aid through the ABC approach. A means airways, B means breathing, and C means circulation. So now the person will be checking for the airways, whether they're blocked or not. And then he'll be giving the jaw thrust. And at the same time, he will be checking the movement of the chest, whether it's moving or not. And next, check for breathing. He will also be checking the breathing rate, whether it's normal or not. In this case, it's around 18 breaths per minute, which is normal. So the breathing is present. Now we're going to check for the circulation. First, we have to stop bleed. Check the pulse first. The carotid pulse should be checked here because the patient is unconscious. His pulse is normal and the volume is also good. So now we have to stop bleeding. In this case, replenishment therapy is not needed because all his vital signs are normal and it is not elevated. And now we have to do the neurological assessment. It should be done in 3 stages: eye opening, verbal response, and motor response. So first, now he's checking for the eye responses, the pupil size, and whether they're symmetrical or not. And now he's checking whether there's any verbal responses from the patient. But in this case, it is not present because the patient is unconscious. And
Can you move? Can you move?
No, let's give it.
No, you should just ask. Can you move? If he's not responding, no one responds. After neurologic assessment, we have to do head-to-toe maneuver. First, you have to check from head to toe. You have to check the head region. So you have to check whether there is any scars, wounds, lesions, or anything, or any fluid coming out of the ears, and also the eyes, nose, mouth, any fluid coming or any blood coming out of the mouth. You can check the eyes also. Check the pupil size and they're symmetrical or not. And then you go to the chest region. You have to do comparative percussion. First you have to inspect, you have to see whether there is any scar lesions or any injuries over the chest region. Then you have to do comparative percussion and record the sound and then conclude the sound. Then go to the abdominal region. You have first inspection, you check whether there is any scar lesions, any wounds, injuries, and then you can palpate and check. If the patient is unconscious, we can't palpate because he can't feel any pain. And then pelvic region, you have to palpate and check where there is any dislocation of joints or any fractures or anything. Then you go to the extremities, lower extremities. You have to check where the lower extremities are straight. If they are straight, that means there is no any fractures, and you have to palpate and check there is any fractures or anything, and you have to check for edema. So this patient is having no edema. Then go to the upper extremities. Flex the knees and check. Flex the knees and check about the activity of the muscles.
Машину.
Then you have to go to the upper extremities. Same way as
Там
you
группа
did
есть с
the
утра
lower extremities of
и,
palpate,
по-моему,
the
с
hand
10
and
часов.
check. And then flexion.
На 10?
Check the contraction.
На 10.
When doing the head examination, there are two signs we have to check: neck rigidity sign and curvic sign. Neck rigidity sign, you have to keep the hand under the head and then move the head chin to the chest region, and if you have to check whether there is any pain or is he resisting. So if he is having anything like that, then we can suspect for subarachnoidal hemorrhage. And there's another sign, curvic sign. Curvic sign, you have to flex the thigh and then have to make it like this. If he is having pain when we are doing this, then also we can suspect for subarachnoidal hemorrhage. The panda sign. And it's called the panda sign. This is due to bilateral periorbital hematoma, or if there is a basilar skull fracture. There is a fracture in the base of the skull. This happens. There is swelling around the eyes. It's called the panda sign. He's having a stabbing wound on his left chest wall, and so we are going to do first aid for that. We can put a semi-occlusive dressing for open. We can suspect for open pneumothorax because it can damage because it's open and can damage the chest wall and the lung cavity. So we can do first aid by putting a semi-occlusive dressing. Semi-occlusive dressing will be like this, and all the sides are sealed except for a small space. And then put it over the wound. It works like this. When you start, when you inspire, the dressing comes out over. When you expire, it adheres to the chest wall. So this is how it works, the semi-occlusive dressing. So this person's chest is intact, and we are suspecting for pneumothorax, so we can percuss the chest cavity and check. Comparative percussion. So you should hear hyperresonant sound if there is pneumothorax. So he must be having closed pneumothorax, as there is no any open wound over here. Then what we can do is he's having dyspnea. Okay, he can have dyspnea. So the first aid we can do is we can make a hole in the chest region and for the air to come out. It's done like this. So I open the thing and the air is coming out. So this is the first aid which is done for closed pneumothorax. We are simulating this as a lung cavity for closed pneumothorax. We are having closed pneumothorax over here. So when this patient inspires, there is more tension inside the lung, the pressure increases. The more and more he inspires, the more air which gets collected inside and pressure inside the lungs increases. So what you have to do is put a needle inside the chest cavity and then release the syringe, and you can hear the sound where the air comes out of the syringe. This is the way how open pneumothorax works in a injury. During inspiration, you can see bubbles coming off. During inspiration, you can see bubbles coming. During expiration, you can see bubbles coming.